Hello, everybody. Good evening. My name is Gabriel Andreuccetti. I'm from the University of São Paulo Medical School. I came here because I was invited to talk about a problematic issue that is the use of drugs in Latin America. I think this is a very complex subject, so I decided instead of trying to solve this problem during 10 minutes, I decided to talk what I have learned during my PhD study on this topic. Well, just to summarize, it all started when I thought it would be a good idea to do cross-cultural comparisons in different countries regarding how people use drugs. So I first started going to California, where I did part of my PhD study on alcohol problems. I also went to some parts of Europe, like Copenhagen, where I could experience some of the European environment regarding drug use. I also went to Australia to learn how drink and drive legislation should be. And of course, I tasted some kangaroo meat, and I strongly recommend you if you can. And I went to Netherlands to go to the coffee shops and also meet some beautiful Dutch girls. But I also did a great course on alcohol and drugs at the University of Amsterdam. So that was basically my background. And I want to start with the lessons that I learned. Well, first of all, I learned that us humans, we have a huge problem about controlling our desire for commodities. What I mean about that, it's in particular regarding drug and food consumption, we make a huge problem for the whole society. Just to make a brief overview, nowadays in Latin America, one death every 2 minutes, we have one death related to alcohol use. And now in Brazil, we can celebrate that more than half of our Brazilian population is overweight. So one of the things I have learned about drug consumption is that we should try to reduce the harms associated with drug use, and also with other commodities that surround us in our society. That brings me to my second lesson, is the need for regulatory systems for drug use. I know some people won't agree with that, but it's something I have learned because drug use is part of our history. We have to understand this. I don't doubt that many past civilizations, they did a much better job than us in controlling problematic use of drugs. But with the demographic growth that we have nowadays, and with the urbanization, it's always impossible to leave these problems for individuals to take control. So we have to bear this in mind. But we should never forget what is the motives that drive the drug consumption. That's really important. I'm going to talk a little bit more later. The third lesson is very important. I have learned that most control policies regarding drug use, they are not perfect. And more than that, they are not based on science. They are not evidence-based. And I cannot speak about that without mentioning one important guy. This is Professor David Nutt, and he has made some extraordinary work on the drug-related field. And he discovered, after many publications in the best medical journals, that in many cases, the harms that we have associated with illicit drugs, they are greatly overstated. And more often than not, they are less than the harms that we have associated with alcohol and other legal drugs, like common prescription drugs. And unfortunately, after he published these articles, he was fired as the drug advisor from the government of the UK. So these are some of the problems that we have to deal when dealing with drug consumption. And that comes for the fourth lesson, is that we have to take into account the cultural barriers. I have been working with the drinking driving law in Brazil for the last few years, and I couldn't think in a better example of a drug policy that came into conflict with a cultural aspect, such as drinking represents to the Brazilian population. And I think, besides all the advantages we had with this kind of law, we totally forgot about the cultural aspects of drug use. For example, we have a zero-tolerance law in a country where enforcement is practically not done, And when we are caught by the police, we have the right to refuse to provide a breath test. So my big question that I don't have the answer, if you can provide me some feedback, is should we have invested in a stricter law for everyone, or should we have invested on more capacity to put sanctions into effect? I don't know the answer, but I clearly know we haven't done the later option, because most of the Brazilians in this audience, they will recognize this case. There are drunken drivers who killed people or injured people on our roads, and they are not in jail. My fifth lesson is that we should bear in mind that addiction is a huge, complex problem. And the funny thing is that the state has made much more difficult for people who use drugs to survive with this problem. And what's more funny is that they cannot escape from the social positions that are the predictors for drug use just because they use drugs. So that's something that we should think about. When I visit some prisons in Netherlands, and I visit these facilities with drug users where they can use drugs, I noticed that we had this huge gap between what people, are we offering these people something else, an option besides blaming them for using drugs? I don't think so. And this should be in our discussion. The other thing I want to talk about, it's about the technology advance. Well, you all know we live in a society with technology all around us. And like this guy here, in less than 20 years ago, he used to have all these equipment for his entertainment at home. And nowadays, he can put everything into his pocket. And when I was comparing this kind of advance in our society with what we have in terms of drug control policies or even social control policies, we are so old. We seem old. And just to give a brief example, we have these new drugs developing every day. Every day we have new drugs, and the best place for you to find drugs nowadays, it's on the internet. Late 2006, just an example, an internet discussion started about spicy, that is like a synthetic cannabinoid, and nobody from the scientific field knew about that. And within hours after this post, someone posted on the internet, it's a synthetic cannabinoid. Well, it took 2 years for the first scientists to publish an article showing that we have synthetic cannabinoids in our society. And nowadays, we have more than 80 different kinds of this kind of drug, together with more than 200 other news that now we are able to identify. So we are really behind on this issue. And the other thing is that how are we going to solve this problem? I think Brazil and developing countries from our region, we have to think if you are able to invest on new things that we are seeing advancing in other societies, or if you're going to risk paying the price for not following this advance. So many other countries in our region, they are already showing advance, changing their drug control policies, and I'm asking where Brazil is going to go. Besides all the criticisms of new kind of policies, what it matters here is if you are trying something new that is not working or whatever. Many scientists from my area nowadays, we agree that if our system, drug control system, is not broken at all, we are in a serious need of repair. And what amazes me the most about this issue is that everybody, from the public audience, our experts, you always think about a two-way solution. It's either criminalizing or legalizing drugs. It's funny because in many other social areas, we don't have a two-way solution for public health problems. So why should you have a two-way solution for this? And many research is showing that this is not the way. People use drugs regardless the policies they have around them. So we have to change something based on evidence, or otherwise you're going to commit the same mistakes we made in the past with other drugs. And I have a kind of solution. I don't think I have enough time to show everything, but really brief, we have to think about which kind of drug we are dealing with. So coffee is the most consumed psychoactive substance in the world nowadays, with little harmful effects for the society, the social level. And we still can sell it, we still can drink here at this audience, and no problem. So we can treat similar drugs with little harmful effects in a similar way. And we also have to think about how we are bringing this message to the youth, because otherwise we're gonna fail, as we have failed for the last 50 years, I would guess. And we should never forget about the social context. That's really important. Policies from developed countries might not work in our countries from Latin America. And just to finish, I strongly believe that the collaboration between different social groups, it's something really necessary. We have these experiences from like Mothers Against Drink and Drive in the US, and nowadays we know that the social organizations, together with the technical support, were responsible for reducing the likelihood of someone drinking while driving in that country. And we have similar proposals here in Brazil, so we should think as a whole society. As this great Dutch author that I like to read him a lot, I think like the success of our future drug policies will strongly depend on the ability that we're gonna have to put people that think differently to act together. That's all. Thank you very much.